Hi everyone, we're group 7 and our topic is enhancing diabetes management with continuous glucose monitoring, also known as CGM. So our main objective is to improve diabetes management by addressing the lack of awareness around CGM among both providers and patients. And then our problem statement is that future providers need to be educated on using CGM devices to best educate patients with diabetes, be aware of CGM tech systems that connect the CGM results to the clinic in order to improve overall diabetes management, and understand insurance eligibility requirements for CGM devices.
The idea we had for our intervention was to basically host a lunch and learn to educate future healthcare providers on CGM fundamentals and its role in diabetes care. We wanted to raise awareness about the added benefits of in-clinic CGM monitoring and ensure that both the providers and patients have a good understanding of insurance eligibility requirements to implement such devices.
So for our background research, we looked at the Healthy People 2030 Objective, D06, discussing diabetes education. Though the goal was to increase the amount of people who received formal diabetes education, they ended up with even less people than planned being educated. We also found a paper initially on HRSA's website discussing the impact of diabetes management programs. One was started at South Central Family Health Center. This program is designed to improve diabetes education and management by using CGM devices and would analyze the data received through the devices in clinic and provide virtual patient education appointments alongside a CGM analyst. This program showed 90% of the patients enrolled in the program had improved blood glucose levels and maintained levels in a safe range. Unfortunately, the article is no longer available on HRSA due to recent federal policy changes, but a portion of it is still available through the FQHC's newsletter. We also reviewed a retrospective cross-sectional study that looked at EMR data from an FQHC spanning 7 years that noted persistent disparities in CGM prescriptions among racial and ethnic minorities and those who are uninsured. This was concerning because those are populations most disproportionately affected by type 2 diabetes. So, though they have the highest prevalence, they also have the most challenges in being able to use innovative diabetes management interventions. For our needs assessment, we surveyed 10 of our colleagues from this program and 2 certified PAs from an FQHC in LA called Clinica Romero. We found that 70% of our fellow PA students did not know how to educate patients on using a CGM device. Many also mentioned that they saw providers face insurance barriers when providing CGM, when prescribing CGM in experiences prior to PA school or even during clinical rotations. One of the licensed PAs that was surveyed also echoed these concerns about insurance. She said that insurance doesn't approve these devices for all patients. They, as the providers, have to document extensively and complete prior authorization to demonstrate how it will benefit the patient. This was seen as an ongoing challenge of realistically using CGM devices in practice in an FQHC setting.
So for our intervention, we separated it into 2 different phases. In phase 1, we assembled a group of 10 future healthcare providers to participate in a comprehensive needs assessment survey and surveyed 2 PA providers who were from Clinica Romero. Our overall goal was to explore their current knowledge, understanding, and potential barriers to CGM. By collecting this information, we aim to gain deeper insights into their perspectives and challenges. This ultimately informed our efforts to facilitate better education and support around CGM adoption in future clinical settings. During phase 2, our goal was to host a lunch and learn session to educate 15 future healthcare providers on the benefits of CGM. And while we intended to have 15 individuals, we ended up having 18 future healthcare providers in total attend our lunch and learn session. Our goal was to inspire and empower these providers to incorporate CGM into their clinics, enabling them to offer advanced and proactive diabetes management solutions to their patients. By sharing valuable insights and practical knowledge during the session, we hope to foster a community of healthcare professionals who embrace innovative technologies like CGM to enhance patient care and improve overall health outcomes.
Throughout the design and delivery of our intervention, we implemented principles of health literacy, cultural sensitivity, trauma-informed care, equity and inclusion, and patient advocacy. To address health literacy, we recognize that many final year students may not have had practical experience with continuous glucose monitors during their training. And to ensure the comprehensibility and accessibility of our material, we employed the SMOG formula, to a method where we assessed readability. Our content was targeted at an 8th to 10th grade reading level, maintaining clarity with adhering to scientific accuracy. This approach was particularly crucial for our Lunch and Learn session, where we introduced fundamental CGM concepts and practical applications. Our objective was to not only educate the students about CGMs, but also equip them with the confidence to explain and apply their use in clinical practice. Our Lunch and Learn session also emphasized cultural humility. We fostered an inclusive learning environment by utilizing diverse and representative educational materials. We intentionally created a space for open and respectful dialogue, exploring how cultural values, financial barriers such as health insurance, and technological limitations can impact a patient's access to or utilization of CGMs. By accessibility was a key to our structure and delivery. And this is, as I mentioned, where we use visuals like videos, tables, and infographics. But along with that, we also provided trauma-informed care, which was another crucial aspect. We aimed to help students understand how trauma, especially amongst marginalized populations, affect patients' healthcare experiences and influence their willingness to use these tools. We address common barriers like financial and insurance constraints and cultural stigma, encouraging the students to promote CGM use respectively and build trust. By prioritizing and understanding, we prepared students to recommend CGM's sensitivity to patients' emotional needs and personal history. Equity and inclusion were prioritized in all aspects of the Lunch and Learn. So students, regardless of background, had equal access to educational resources and support. The content was transparent and accessible and culturally responsive. And the role of CGMs in reducing diabetes disparities was highly emphasized. Advocacy was a core focus beyond learning CGM technology. Students gained knowledge and skills to effectively advocate for patients, especially those with barriers to care, and strategies for navigating insurance eligibility, assisting patients with device access, and supporting clinics integrating CGMs were also explored. So all in all, healthcare providers with this knowledge and advocacy skills can significantly impact diabetes management and system benefits, which was the core of our intervention.
Our project goal was to inspire and empower future healthcare providers to incorporate CGM into their clinical practice. By doing so, they'll be equipped to offer more advanced and proactive diabetes management for their patients. Through our CGM presentation, we set 4 key objectives. First, all participants will be able to recognize 3 core benefits of CGM, such as improved glycemic control, reduced hypoglycemia, and greater patient engagement. Second, they'll know how to identify the appropriate point of contact when implementing CGM in their future workplace. Third, they'll be able to correctly walk through the steps of applying a CGM device. And finally, they'll leave with the confidence to determine patient eligibility for CGM use under both Medicaid and Medicare. Our hope is that this knowledge empowers them to drive meaningful change in diabetes care.
So we used pre and post surveys to gauge where our participants were at before our Lunch and Learn session and how much they learned at the end of our session. For question number 1, the top is our pre, bottom is our post. You'll find that as a common theme in the following slides. The first question, we basically were trying to understand the benefits of CGM. So before the training, most of the participants were pretty much familiar, and after the session, the understanding remained strong. For this second question, it revolved around the correct application of a CGM device. After the session, nearly everyone selected the correct order from device selection to cleaning the site. This basically tells us that the virtual portion of the training was very effective. For the third question, this focused on who handles CGM setup in the clinics. There was a lot of uncertainty here in the pre-survey, with answers varying from glucometer reps to SP, supervising physicians and pharmacists. After the session, most people agreed that glucometer representatives are the primary point of contact, which is what we discussed during our lunch and learn session. Our fourth question focused on confidence in identifying eligibility. This question by far is where we saw the most dramatic shift. Before the training, majority of our participants were not confident in identifying who qualifies for a CGM. After the session, nearly everyone reported being either confident or very confident, as you can see in this graph below. Our last question focused on patient case eligibility. Almost everyone got this one right at the end of the session, and this shows that discussing real life examples during training can really help make the lesson stick.
So some obstacles and solutions. The first obstacle was funding for the lunch and learn. We initially wrote a donation letter to Costco in hopes of getting funding for pizzas and waters for the lunch and learn, but unfortunately, we were not able to get the funding from them due to renovations at the food court. So we asked the Latino Alumni Association, and they were able to provide funding. So we were able to get food from Albertsons. And then the second obstacle was that we tried to provide Dexcom CGM devices for demonstration during the lunch and learn, but unfortunately they did not come in time. So a solution for that was that we played a video, and that video helped show the steps of the CGM device. And then the third obstacle was that initially we had hoped to record our intervention to put it online for sustainability efforts, but unfortunately the audio was not working. So a solution for that would be moving forward just to make sure that the audio settings are working properly.
So on reflection of our discussion and intervention, some of the highlights that we noted were the engaging Q&A session afterwards. So kind of clarifying beyond what was presented in our lunch and learn. Additionally, the fact that we were able to show a video and have a step-by-step practical application seemed to resonate with those attending. And as we'll discuss in the next slide, how it impacted them in a relatively quick manner. One thing we hope to do for future interventions is hopefully actually incorporate those sample CGMs as was mentioned prior. And with permission of the colleagues who attended the lunch and learn, the following day, one of the attendees was actually able to do a sample drug order for a patient in clinic for a CGM. Additionally, another colleague on a personal note, based on the Medicare guidelines showed at the lunch and learn, was able to advocate for a family member to get them a CGM after attending the lunch and learn.
So our goal overall with this project was to improve access to quality care for as many patients as possible. Incorporating the use of CGM devices and FQHCs in community clinics is one of many ways that we can do that. When we go to extra mile to educate our patients on their conditions, on their risk factors, and all their management options, we in turn equip them with the tools that they need to make decisions regarding their health, especially in their day-to-day. When people have the tools and the knowledge to make informed decisions, they feel empowered and more in control of their outcomes. So we encourage you as licensed providers who have been either practicing or entering the field to foster a mindset of collaboration with your patients. What would that look like in your practice? Secondly, times are changing and the world is quickly evolving. With that comes constant new innovations and technologies. A device like the CGM could be life-saving for your patient. So what are ways that you can incorporate these technological advances into your practice? Lastly, just as it is important to collaborate with your patient, it is equally important to collaborate with your team. We have been privileged enough to be exposed to various professions in healthcare, all playing vital roles in how we function as a healthcare system. What can you do to advocate for more involvement of these roles in order to get the best outcomes for your patients? So we will leave you with this thought. The road to equitable care is long, but it's one we never walk alone. Every day we will stand alongside our patients, our communities, and each other fueled by the same purpose that brought us here in the first place, to serve, to advocate, and to heal. If we carry that purpose forward, not just in what we do, but in how we do it and the effort that we show each day, then real lasting change isn't just possible, it's inevitable. Thank you for your time.